chose it because it was suggested as getting the optimum results. I had confidence, having been in this practice before, that what I was being told, or how I was being advised, was based on, was in my best interest.
Majority of people are just doing the PRP.
And that is some testimony this morning from Andrea McIntyre. She's from the Colony. She underwent special treatment to deal with thinning hair and hair loss. And one of the new treatments out there is called platelet-rich plasma, or PRP therapy. It's a process in which a patient's blood is drawn and then put back into the scalp. And Dr. Joseph Yeager of the Texas Center for Hair Restoration Procedure performs that procedure, and he's joining us here this morning. And hair loss in women, we talk a lot about balding men, but a lot of times women don't really like to talk about this, but it's fairly common.
Absolutely, absolutely. It's a silent epidemic is what I call it. There'll be about 50% of women that will have hair loss by the age of 50 years old. And about 30 million women in the United States actually suffer from some form of hair loss. And
not just loss, just even like thinning.
Absolutely.
And a lot of people think is it stress, menopause,
age,
all of these
genetics.
are factors?
Absolutely. There's multiple factors.
Well, tell us a little bit about this procedure and how it can help someone who's dealing with that particular issue.
Sure, absolutely. So we found that the PRP, the platelet-rich plasma, contains a rich concentration of growth factors. And when putting them back into the scalp, they help grow the hairs in thickness and in length. So it improves the function of those hairs. So for people who have thinning hair, this is a perfect treatment for them.
And kind of tell us how this differs from a hair transplant, because I know I'm looking at that video and it kind of looks similar to that process, but it's not the same thing.
Sure, it is not the same thing. This is considered a non-surgical treatment. We do have to use a local anesthetic, so there are some very fine needles that will be used onto the scalp. Once you are numb, you do not feel anything. With an actual hair transplant surgery, we are actually moving hair from the back of the scalp and moving it to the front.
And so basically this just stimulates hair growth in that area.
Correct. We are waking up those dormant hair follicles.
And so how often does one have to get this procedure in order to see the maximum effect?
So my protocol calls for 2 treatments, 4 weeks apart. You'll generally see a cosmetic benefit about 4 to 6 months after. That's on average. We've seen as soon as 6 weeks. The results last anywhere from 9 to 12 months. I had a patient that lasted 18 months. So it is an annual treatment. But it's a lot less maintenance than having to do minoxidil or Rogaine, for example, twice a day.
And is this something that's typically covered by insurance, or is it considered cosmetic?
This is considered cosmetic, yes.
How much does this typically run?
I add amniotic stem cell therapy. It gives the PRP an actual boost, so you get the added benefit of more proteins and more growth factors that kind of act as a structural support. So both of those together is $2,899 for both treatments together.
For both treatments together. Is there an ideal candidate for this, or just, I guess, anyone who is dealing with this problem?
Correct. There are some limitations, and we would discuss that at our consultation, but very, very minimal amount of limitations.
Well, thank you so much for joining us this morning. I know that's something that a lot of women would be interested in learning a little bit more about. Still ahead on News 8 Daybreak, Lake Lewisville might be open for boating, but the water still too high to reopen at other areas. We'll tell you what the impact is having on businesses that are trying to stay afloat. And then a warning for residents in Highland Park, what to do with